Hey, Priya. So wait, crap, I did not download the latest. Oh, did you change anything in the slide, or is the one that I sent is the latest one?
The one you sent is the latest one, Ivy.
Okay, I thought I had to download another one. Can you see the screen okay?
Yes. Maybe should we wait a couple minutes to let more people come in, or go
Yeah, I
ahead?
think we should wait a couple more minutes. Yeah.
Mm-hmm.
Actually, I had to complete the survey to be allowed into the room. So I guess I had left it incomplete and got registered, but so some people may be experiencing a delay.
Mm. Welcome, everyone. I think we can maybe wait 2 more minutes before we start.
I think this might be a good point to start, and we'll let people trickle in as the event goes on.
Okay. So welcome everyone. Welcome to our first CHET's Kitchen events. Today we'll be talking about food access and insecurity in the city of Chicago. We have our two health equity scholars, Priya and Sam, will be presenting. And if you have any question, please feel free to raise your hand or type it in the chat. This is a open discussion session. Thank you.
Thank you, Ivy. So we will begin. If you can go to the next slide, Ivy. So as we have mentioned, today's topic will be about food insecurity in the city of Chicago. So what is food insecurity? The USDA defines it as the lack of consistent access to enough food for a healthy and active life. So access to produce, dairy, poultry, meat, healthy fats, and other food groups that make up a healthy diet. Additionally to that, as the Greater Chicago Food Depository had mentioned, that it is also the set of circumstances that prevent the access. Some examples of that are food deserts, which also coincide with transportation issues to a nearby grocery store, farmer's market, urban farm, even a food pantry or other sources of some food. In addition, other circumstances that can affect and impact a level of food insecurity someone may face are natural disasters, and we're seeing more this year. And on top of that, also a global pandemic. Here is a map from 2016 from the Greater Chicago Food Depository's website, which within Chicago itself shows rates of food insecurity. And as you can see here, the darker shade green is the higher rate and the lighter shades are lower rates. I am curious to see a new map as of 2020 to see how COVID has impacted the rates and shift in if other neighborhoods and communities will go to a darker shade. But as of 2016 and up until 2018, 2019, this has been pretty consistent, where areas in Chicago that have felt the higher impacts of food insecurity are the south and west sides. But it is also noticeable in the north and northwest sides of Chicago as well. So food insecurity is linked to health outcomes, both physical health and mental health. There are various chronic illnesses linked to diet and nutrition, as we know. So those who are food insecure have a higher chance of having chronic illnesses such as diabetes, hypertension, various heart diseases. Along with that, behavioral health is also an issue, especially for youth. Anxiety, depression, and also just overall restlessness from not knowing either when one's next meal may come or what type of meal that may be. That can also lead to loss of attention, and also anemia and other nutrient deficiencies. So overall, it leads to very poor overall health status. We wanted to add a slide that discusses the My Plate guidelines, because it's important to relate these guidelines in relation to food insecurity and those who may not be able to access food that will lead, as the definition says, to a healthy, active lifestyle. So according to the My Plate guidelines, at least 40% should be of a serving of vegetables should be on a plate, along with 20% protein, 20% grains, and 30% grains, and then 20% fruit, and a smaller percentage of dairy. And also, My Plate recommends a low sodium diet and a low fat diet, which, if you think about, for those who are facing food insecurity, sometimes if they don't have healthy resources near them, following My Plate is extremely difficult, and it brings to inequitable access to the dietary nutritions that they may want to follow for their kids or as adults as well. A lot of the if they have convenience stores or mainly food pantries, those tend to be more processed, high sodium foods, which can lead, as I had mentioned earlier, to chronic illnesses. We also wanted to discuss poverty tax and its relation to food deserts and food insecurity. It is not a real tax. It's more of a underlying issue that is not as well known. So what it is basically a set of circumstances where, in an area that may be lacking multiple resources for fresh food, such as grocery store, farmers market, community garden, if there is just one corner store, one convenience store, or even just one grocery store, the prices are higher, especially for an area that may be lower income. In addition to that, the price of trying to travel to another area to purchase any food and produce or meat and dairy also go into the poverty tax. And this has been this is national, not just in Chicago, but it's important to think about when studying food insecurity. Also, we wanted to mention that though there has been an increase in full service supermarkets, which will have not only the canned or prepared meals, but also fresh produce. There's also been an increase in distance to grocery stores and full service supermarkets, especially in certain neighborhoods in the south and west side, which leads to higher rates of food insecurity. In the survey, when registering for this event, we asked a question about grocery stores and if they are a lasting impact to decrease food insecurity. And that is something that past Mayor Rahm Emanuel believed so. And some of you may be aware that he brought grocery stores to Auburn Gresham and Englewood. And when the Whole Foods came to Englewood, there was a lot of mixed feelings and backlash from community members, especially longtime community members. One about how the prices were not lower given the cost of the area and the cost of living in that area. Also, there was no education on certain produce or the basic information on nutritional guidelines and eating habits and the benefits of eating healthy, but also just education on how to cook fresh food, fun food with your family on a budget, nothing like that. So there was a loss of and lack of cultural competency in that regards. Also, some community members, we have linked here a couple sources if anyone would be interested in following up, but community members who were interviewed about the stores were saying that they felt like it was just bringing gentrification because those people were coming in from different neighborhoods to shop, and it just changed the appearance of their sense of community. But since then, Chicago has been working on numerous efforts to reduce food insecurity. And this is mainly done through nonprofits and community groups and community organizers throughout the city. So we've highlighted quite a few good ones doing amazing work that have been doing this for a long time. And the first one, many I'm sure are familiar with, is the Greater Chicago Food Depository, which throughout COVID and prior to COVID has been amazing in during the summer months providing summer meals for CPS students through and partnering with nonprofits that do summer camps and other activities to provide free meals. And then throughout the entire year, and especially the holiday seasons, they have various food drop-off programs, and they also have information and staff who will help with SNAP enrollment and benefits questions that are there whenever necessary. Also, Urban Growers Collective has been around for some time as well, and they have created a mobile produce bus that has gone through mainly the west side and parts of the south side as well. I think it's trying to grow its location services as well. And so the bus does accept SNAP card benefits, and people are, it will have fresh produce, and it has a schedule of when it goes through the communities, and people can get food that way if they have no means to go to a grocery store elsewhere. And they also have been working to do a prescription for health program, which I'll also talk about later, but this is after doing a food insecurity screening, helping those who are food insecure after an official screening get a prescription for certain produce or dairy and eggs and other items like that. In addition to those two, a few others we wanted to highlight are Growing Home, which they have been working to work on not only also urban farming, but employment and training. And so also with employment training, teaching people to grow sustainable food sources. And Common Threads, Purple Asparagus, and Big Green Chicago's, they work with the K through 12 CPS system to do a after-school programming and sometimes in-school programming where they provide demonstrations on healthy meals, the importance of healthy eating, along with overall wellness of exercise, but also they can do it with families, and parents or family members are invited to see these demonstrations. And they're also then given information on recipes for great, affordable, healthy meals that are quick to make as well. And there are also one example of a great farmers market in the city that does a link match program is the experimental station, the 61st Street Farmers Market. And so they will do a link match for anyone who uses that at the market. And as I had mentioned earlier with the food insecurity screening, we listed some, Advocate Aurora Health has been doing this, and we listed some of the questions that.
Priya, I think your audio, your headphones or your mic might have disconnected.
Versus other utilities. And then another question that is asked is,
Hey Priya, will you go back a little bit because you were cut out for a few seconds?
okay, yeah, sure. To the last slide?
No, just this slide is okay. Thank you.
Okay, sure. And thank you for letting me know. Sorry about that. So Advocate Aurora Health, as I had mentioned earlier, they are also doing food screenings, food insecurity screenings. And so we've listed a couple questions. So common ones to ask are within the past year, how worried was a person with whether their food would run out or if they had enough money to budget to buy more and pay other necessities, whether that be utilities or anything else. And then we also wanted to touch on healthy living pharmacies, where at a similarly to a food prescription, this is where those who need free access to certain foods, whether that's fruits and vegetables or other farm products, can get these. And community health workers help to make sure that these food pharmacies are accessible to those who get connected, and that could either be through a hospital system or the public health and community health systems or the food depository itself. We also wanted to touch on COVID-19 and food insecurity in Chicago. Prior to COVID, I don't think I touched on this earlier, but I did want to mention, prior to COVID, a big issue is that many people who are facing food insecurity may have to decide whether they spend money on food, fresh food, or they spend money on other necessities. And COVID has definitely impacted this even more, and it is done so by increasing the number of food distribution sites, as so many, I don't have the exact number in Chicago, but how many people have changed their employment status or are just more in need at this time. And because there is a bigger need, like I mentioned, the food drop-off sites have increased to other locations in the city. So I do want to see a new map by the food depository to see food insecurity rates throughout the city. And also, there has been some progressive and proactive action on addressing food insecurity in relation to COVID. So CPS since March had a plan to continue to provide free meals to students through the summer months as well. And they have given over 21 million free meals. And these are meal kits as well. Addition to that, there is a drastic increase in those who are receiving services or benefits from the food depository, a increase of 120% since January of this year. And as of 2018, about the food insecurity rate in Chicago was about 12 or so percent, and now it has gone up as 1 in 8 now are food insecure. So what can I do, what can you do? What can anyone do? There's multiple steps we can take. I think that there, honestly, in my opinion, looking into the Greater Chicago Food Depository or local food pantries near you is a great first step. And they're always accepting donations. On their websites, they list what they will take and what they won't take. Along with that, just talking about it and telling others and the factual, spreading facts about this is important just to get the conversation going. Also, we wanted to highlight the importance of shopping at farmers markets and supporting local farmers, as this this is like, there are so many urban farmers in the city, and they have also been impacted by COVID because the city, and actually a little bit prior to COVID, the city of Chicago had created a new water, those who want to access City of Chicago water at the hydrants, there's a new permit, which is a costly permit, and not everyone may be able to equitably afford it. And so that has drastically impacted the use of water supply to grow and harvest and produce fruits and vegetables. And this is definitely seen in Black and Brown communities where there's possibly more land to do urban farming. And so we want to shop at farmers markets and urban farms, not only for that reason, but because they are also champions for increasing food insecurity. Many farmers markets do the link match program. They also accept SNAP benefits. And I do believe, I don't know if we've listed it, but I'm sure that there are some that would also work on education on healthy eating and SNAP as well. Also, you can volunteer if you have the time and resources to do so at some of the listed organizations that we mentioned. There are also a few more out there that we have not touched on that are worth looking into if you're interested in volunteering. There is also the Chicago Food Policy Action Council, which does take members. And so if you're interested in learning about food policy in the city, sustainable food sources, urban farming, and food access and food insecurity, they're a great organization to follow and either get their monthly newsletters or become a member. There's also legislation that you can support and advocate for. Currently, there is a petition going around, and we have linked the change.org petition link, which addresses, as I had touched on, the making water access from the City of Chicago water access more equitable for urban growers and farmers to be able to continue to sustainably create and sell their produce to the community and those who will buy it from them. Also, there is in the works, as far as I know, statewide, a couple legislation that prior to 2020 had passed in the state house and needed to go to the Senate. One was expanding the use and benefits of SNAP. So some restaurants would now be able to accept SNAP benefits, and possibly letting the hot prepared meals at grocery stores also accept SNAP benefits, because they don't at the moment. But I do also know during COVID, I don't think that the hot prepared meals are at grocery stores. So that portion of the legislation might have to be changed, but that is something to keep an eye out. And if you are interested in contacting your state and local legislators about that, there's also getting active with advocacy and legislation work as well. And with that, I will pass it over to Sam.
Perfect. Thank you, Priya. Can you guys all hear me okay? Good. I'm going to go over our partnering organization today. As you guys all probably saw in the survey that you took, the pre-event survey, that there was an option to select a discount codes towards a CSA box, and the partnering organization is Star Farm Chicago Marketplace. Star Farm is an organization located right here in Chicago. They have a high priority in community engagement and community-based efforts. And they really focus on promoting a safe and inclusive environment for those in the community. Star Farms definitely is a very impactful organization with a variety of different ways that they get involved in the community. You know, for example, they have vocational training, horticultural therapy, youth programs, community events, composting services, and they even build gardens. So there's a variety of things that they kind of touch into throughout the community. For this event specifically, we partnered with Star Farm to provide discount codes towards community supported agricultural boxes, otherwise known as CSA boxes. Once again, tying into their community efforts, these boxes are based around community engagement. CSAs rely on communities to support the farm's operations, with everyone providing mutual support and sharing kind of the risks and benefits associated with the process. So these CSA boxes contain fresh and nutrient-dense local produce. You can order them by monthly, weekly, or even at a one-time purchase. Ivy, if you could go to the next slide. Thank you. So one of the big questions that we had throughout this was, have you thought about what you'll eat in this upcoming season? Now, in our society, we are able to go to the grocery store at most times and get whatever piece of produce that we want. But in reality, you know, a lot of these produce aren't either natural to the Midwest, or you can't get them all year round. So in support of sustainable eating and our local farms, seasonal CSA boxes offer an opportunity for us to like capitalize on the Midwest natural seasonal produce. So one way that Star Farms is doing this is they offer, for example, winter CSA box. And in these CSA boxes, they contain apples, onions, spinach, you know, a variety of different things that are all natural to the Midwestern environment during the winter time. So following this presentation, I believe an email will be sent out containing a link or a list of seasonal produce for the area, so you guys can check that out too. And then, yeah, if you could go to the next slide, please, thank you. So right here, you can find the contact information for Star Farms. There's a variety of different things here. There's their phone number and their website and some social media. I would definitely check out their social media, give them a follow, like their pages, right? On these social medias, they'll provide updates of, you know, events, where they're located, times they're going to be there. So especially coming up onto the winter months, that will change, and they will provide updates on where you can kind of get some of their winter produce. And then also that information will be shared in the email that I also mentioned previously. So now I think if anyone has any questions, I think Priya, Ivy, Araceli, or myself will take a few minutes to answer those, and we may even have some questions for you guys to answer as well.
You can, hi everyone, this is Araceli. Feel free to add questions in the chat, or you can go ahead and unmute yourself if you have a question. I know we have a small group today.
Hello, I have a question. So this question is for Priya. So you had mentioned that there's legislation, or there was legislation that would allow SNAP benefits to be used for like sort of like the hot bar or hot meals in grocery stores. Why was that sort of contentious, or why was that not previously you know, part of the benefits? Is it because it's like based on weight and there's no way to like control it? I'm just kind of interested about that.
Yeah, that's a good question. I am not sure of the exact answer to that. It might possibly be because of the weight. I do know that there's just a general guidelines with the SNAP benefits that it was just packaged items, or like produce and dairy and other items like that can be used at a grocery store. I will try to look into that more. I don't know the full answer.
Hi, Priya. This is Johnny. I have a question as well. As for, like, we were talking about the, like, how things have sort of changed over COVID-19 and how that's impacted the community. I'm kind of curious on just like we all saw shortages of certain types of things? Were there things that were specific that were then harder to achieve, like to get, or if we're looking to donate anything or stuff like that, is there anything that's more particularly like now in need, or like, I guess both, just theoretically, like I'm curious as to what happened and how things changed, the need changed, and also how to best support.
That is a great question as well, Jonathan. I would, if you are interested in donating to anywhere, I would look at their website or contact a food bank such as the Chicago Depository or others. They may tell you exactly what they do need. I know some food banks also accept fresh produce and some do not. So it also depends on what they take. Just the fact that there has also been more need for distribution sites, I would see if you're interested in your community or a different community throughout Chicago, see if there's any resource there first and contact them, and then expand if you can.
I want to add on to that, we have an upcoming, I think it's already out. We have a podcast episode that we interviewed someone from the Greater Chicago Food Depository. They had mentioned that their needs have shifted a little bit, and they do have some shortage just because of the supply chain issues. But I think they probably end up needing more non-perishable, because people might not be going to the food bank as frequent as they used to be. If we don't have any more questions, I think Sam has some question that we can have a small, short discussion, and we just want to hear from everyone.
I think I see an answer from Steph in the chat, answer to the SNAP healthy food question from earlier. And Steph says, at places outside of grocery stores, it's limited to only ingredients because it's meant to promote only purchasing of healthy items. There's also this notion of, if you can't afford to go out to eat, even if it's at a grocery store, why are you on link? And silly in my opinion, a necessary policing of low-income families' choices. That's very true, Steph. Anyone else have anything to add on to that comment or that question? If not, Sam, do you want to go ahead with the questions?
Yeah, I can totally ask. So this is a question for anyone to answer or add on to, is that going off of our partnership with Star Farm today, what is something that prevents you from shopping at a farmer's market or joining a CSA?
And anyone can feel free to unmute themselves and participate in the conversation.
I think, yeah, for me specifically, I always like think about joining these, like either CSA or like an imperfect produce and stuff like that. But to me, it just becomes my planning for a meal is so like last second, and I guess I could plan around the produce I receive, and that would probably be best because it's seasonal, it's fresh, but it always ends up being like I don't know what I'm gonna make with what I'm gonna receive, and so it becomes this like I don't know, difficult position. Like it's not really not that difficult. I could just look up a recipe with all those ingredients, but like I hesitate just because of that, which is not a very good reason.
I can relate to that, Johnny. Is anyone in the discussion right now? Does anyone have any advice, or do they often shop at local farms or farmers markets? And how do you plan? Like, how do you plan your meals and plan to use all this produce and plan ahead?
So I guess I'll speak on that. I do agree it's really difficult for if you are not good at cooking or just be creative with cooking, it's kind of difficult to plan your meals and figure out what to cook with what you get, and especially when you don't know what you'll be getting. But I think if you are aware of what's around in the season, you can kind of figure out what type of things you can do. So in the winter, you get a lot of squashes. So you can plan on you get some like winter squash, pumpkins, spaghetti squash. So you can kind of have an idea what you can do. Maybe a lot of stew, or maybe you can make curry out of them and then make pumpkin pie or pumpkin bread, zucchini bread. And I think nowadays a lot of the CSA, when they send out an email to let you know what you'll be getting this week, they'll include a couple recipes. You do have a few days ahead of time knowing what you'll be getting, then you can look up what you can do with it. It just requires more learning, I guess. But I think once you get on it, it's more of a habit, like anything else.
Yeah, this is Melissa. I agree with Ivy. You can pretty much stir fry anything, put anything in a tortilla, make a soup. Just be creative. You'd be surprised if you have some basic sauces in your refrigerator. You can kind of cut it up, put it in, roast it, and put it in the oven and put some sauce on it and wrap it with some kind of bread or tortilla and call it a day. So be creative, and you know, the internet has some, I think there's some apps as well that you can like send a list of foods and you'll get like possible recipes with the food back to you. So those are all good too. Be creative, be fun. I mean, who cares? The worst thing that can happen is you make something that requires a little extra salt or, you know, salsa. Cholula sauce goes a long way, and soy sauce depending on the type of food you're cooking.
I would echo Dr. Simon in terms of roasting. I think roasting was probably my single biggest breakthrough when it comes to vegetable. Like I used to hate kale, and now I just throw kale in the oven and it just makes things better. So roasting like basically everything has really helped me in terms of meal planning. Like I don't have to think about it. I just put on a pan, it goes in the oven, and then it's done. And then it can be mixed with pastas or rice or whatever.
Yeah. To add on to Laura, if you're into all the fun gadgets that are out there, we recently got an air fryer, and you can make a lot of really yummy things with veggies, like veggie chips. I know I really like kale chips, and it's not until I put them in an air fryer that they came out like how store-bought chips come out. And it's very similar to roasting or frying, but it uses a lot less oil. So if you're into using like gadgets like that, getting something like an air fryer or a slow cooker to make soups with veggies. And then I know like if you take into consideration meal planning, you can also freeze batches of soups and then defrost them later on. So that's a good way to make those veggies go longer and make use of them.
I also want to add that I don't usually cook the veggies ahead of time because I like them fresh unless I freeze a soup and stew. But I always cook some kind of grain or carb on the side. So I would have quinoa, rice, pasta, couscous, something ready, easy in the fridge to reheat while I cook the veggies fresh.
Those are all, that's a lot of great ideas. Thank you. I could definitely tackle that.
Yeah, you totally can't go wrong with putting it in some soup or, you know, like ramen and stuff like that. I mean, I remember being a medical student, you know, having ramen on hand and then boiling it in water and throwing the vegetables in at the last second. It works.
Yeah, so I think another question that we have for you guys is based on, I know Priya outlined it and I mentioned some programs as well, as there's all these great organizations in the community. And what are some ways you think that we can support these local efforts and support these organizations and get the word out of what they're doing in our community.
So I'm just gonna start out with, since Sam pointed out Star Farm's social media earlier, a lot of the time it's simple as resharing their posts, just get their word out, because they are on the farm actually doing the work. They don't really have a lot of support to have a social media person or like a PR person. So for us, like even just following them and resharing what is happening on the farm, they might need some, like Star Farm would post that they need some drivers just one day a week to help deliver produce for people who can't afford them. Urban growers, they need volunteers all the time, and then they share a post that they need someone help at this time, at this location, and just help sharing things like that is already very helpful. It's small things that you can do. I think it seems daunting for a lot of people to try to be supportive of this type of work. But if you are, since you are at this session, is just trying out a CSA box, that is already helping them. So hopefully you guys will move forward and trying one of the boxes with our credit. And I don't know if we have any other questions, Sam.
No, and I was just going to touch on what you said and say that like sometimes it can be, we can underestimate the impact that, you know, just sharing that post does, or just getting the word out in some way, shape, or form. So I think just taking those next steps and supporting these organizations is huge and can make a kind of expand their reach as well. So for me, yeah, so here we go. We can go on to the next part then. So lastly, we're just going to share the post-event survey with you guys. If you could please check this out and please complete the survey, that'd be awesome. It's an important aspect of the entire event for us and you as well. So, and as mentioned previously, we're going to share a lot of the information in here in an email later on that will have seasonal produce lists, recipes, contact information to Star Farms, and some links to other organizations. And also, I believe, a list to local farms and farmers markets that we kind of accumulated and created. It is important to note, though, if you did elect to receive the discount code for the CSA box, then your contact information will be shared with Star Farm. And that's simply to arrange payment and distribution of the products. And then lastly, just keep an eye out for our next Chet's Kitchen event. That's actually next Thursday, I believe October 1st at noon. And we'll be talking more and learning more about sustainable eating from the Chicago Food Policy Action Council. And also check out the podcast that Araceli put in the chat, I believe.
Yes, I put that in the chat, and you can always look us up on SoundCloud or wherever you listen to your podcast, and just look us up as Skinny Trees Podcast. And when you look up the word Skinny Trees, make sure that's without a space between those two words. I know sometimes people have a hard time finding us. And I think I'm going to share my screen for a little bit, just to show you where you can find the podcast.
And Araceli shared the post survey link in the chat, and we'll be sending it out in the email as well. And we hope you will give Star Farm a try. After you complete the survey, we will send out the information to them and connect you guys with the farm.
So again, these are just some of the places you can check out the podcast, and you can find it on most listening platforms like iTunes, Stitcher, Google Play, Spotify, and SoundCloud, and our social media handles as well for the podcast. So actually, if you have time now and you're able to open the link, it would be good to go ahead and do the post survey during this time. It really helps us out, and it'll ask you a question at the end whether you want to receive the credit towards the CSA box.
And lastly, I want to add a thank you to your wellness office for supporting this. They are the one who is able to provide us with these grants to provide the CSA box credit. And so for you to fill out the survey is for us to report back with some metrics. Thank you.
And thank you to our health equity scholars, Priya and Sam, for this wonderful and very informative presentation.
Thank you everyone for joining us today for our first CHET chat.
Okay, I think that gives everyone time. Please make sure to open that link before we end this meeting, but we'll also send it out in a post-event email, but make sure you open that link. And lastly, thank you everyone. Have a great rest of your day.